We will primarily be focusing on loans and grants. So I'm sure that you've been hearing a lot of information on the news and through websites on different loans and grants that are available. We're going to talk about each of them, some details, what is reimbursed, what is not, how to qualify, what exactly is covered, so that you know if it's something that you may want to pursue or something that you should be on the lookout for. So the first one that we're going to talk about today is the Small Business Association Paycheck Protection Loan to Grant. So this one starts out as a loan, but it can be forgivable if you follow certain guidelines. So there is currently there was $349 billion in forgivable loans to help small businesses ride out the economic storm. So the money from this grant must be used to pay employees and business expenses like utilities, rent, mortgage, insurance, things like that. It's not for expanding your business, buying new things. It's just for your day-to-day operations. The primary criteria to not have to repay this loan is to not have any layoffs. There are likely more, but that is the primary takeaway from this one. It is a first come, first served, and so far $217 billion has been given out of 880,000 applicants. More money might be on the way as long as Congress agrees. And the way that you apply for this loan, if you haven't already, is through your bank. And it has to be a bank that you already have a relationship with, that your business has a relationship with. Don't go to a bank that you haven't worked with before trying to see if, maybe they're ahead of the game or something. You need to work through your bank. So our recommendation is to be persistent. A lot of money has already been given out, so just keep trying. And as long as you don't let anybody go and you follow the guidelines, then you won't have to pay the money back. It will turn into a grant. Okay, so our next grant that we're going to discuss today is the HHS Grants. So this grant is really interesting. It comes from the Department of Health and Human Services. They delivered or are currently delivering $30 billion to providers through direct deposits. So these direct deposits are happening through your clearinghouse. They are partnered with the United Health Group. The deposits are primarily happening through the clearinghouse. I have worked with one group that said that they didn't see it through there, but they checked their OptumCare portal and the reimbursement was displayed in there. If you don't have an automated account, then you will get a paper check from CMS for your reimbursements. If you're wondering how much you will get reimbursed, it is based off of your 2019 Medicare fee-for-service revenues. It is not including Medicare Advantage and proportional share. After you receive your reimbursements from the HHS grant, you have 30 days of getting the payment to sign an attestation confirming that you got the funds and you agree to the terms and conditions. HHS is going to be launching an online portal for providers to sign the attestation next week. So that's not currently out, but please keep an eye out for it. And if we have any more information next week, we will let you know. And HHS has announced general principles for the next round of funding. So they are quoting that $100 billion will be coming in the next round. This will favor providers in coronavirus hotspots, but timing has not yet been announced, and a formula for how it's going to be dispensed has also not yet been announced. We also recognize that this shortchanged some providers without Medicare FFS, but the next round will be allocated differently, so hopefully more providers will be included. Okay. Our next program that we're going to talk about that you can receive funding from is the telehealth program. So this is not a grant per se. There are specific steps that need to be completed in order to get money for this. And you also must qualify. So currently there is $200 million available to assist with your telehealth programs. Funding is going to be targeted towards the areas that have been hit hardest by COVID-19 because, we all want our patients to stay healthy and stay at home unless it's a medical emergency. Lots of telemedicine is happening these days. The program is limited to nonprofit and public eligible healthcare providers. If you would like more information on who is eligible, you can go to the FCC website and search for Form 460. This provides immediate support to eligible healthcare providers responding to COVID-19 pandemic by fully funding their telecommunications services. So it will pay for information services, but it will also pay for things for the patients, like their pulse ox, their blood pressure monitors, things like that, things that they can do at home. It will only, however, reimburse you for these items if they are Bluetooth enabled, Wi-Fi enabled, and they can sync with your healthcare technology. So there are certain things they have to be compliant. There are certain requirements that need to be met in order for these to be paid for. So how this happens is you will check the Form 460, see if you're eligible, and then you can submit an invoice form and supporting documentation to receive your reimbursements for your eligible expenses. Applicants who receive funding will be required to comply with all the program rules and requirements, including applicable reporting requirements, and you may be subject to compliance audits. Currently, you must apply for this through a PDF. So the portal is down as of today, so keep checking your FCC, Federal Communications Commission, to see if it's back up. But if it's not, you can still apply through a PDF. All right. Next, we will be talking about the Advanced Accelerated Medicare Payments. So more than 25,000 requests from healthcare providers have been received. More than 17,000 of those requests have been approved for total payments of over $51 billion. Providers or suppliers must have billed Medicare claims within 180 days immediately prior to the date of signature on the provider's request form. You must not be in bankruptcy. You must not be under active medical review or program integrity investigation, and you must not have any outstanding delinquent Medicare overpayments. Some additional information on this is the American Hospital Association this month sent letters to the largest health insurers asking them to support stable cash flow by offering accelerated payments or periodic interim payments during the pandemic. Insurers including United Health Group, Pittsburgh-based Blue Cross and Blue Shield insurer Highmark, Blue Shield of California, and Blue Cross of Ohio are providing such services such as advance and expedited payments and loans and more favorable repayment terms to providers. So one key thing here that you need to be aware of is this does have to be paid back. So providers have 210 days to pay back this loan. Hospitals have 1 year to pay back the loan. And the date starts from the date that the check was issued, not when, the pandemic ends or things like that. It is the day that the check is issued. That is the start time for how many days you have to pay back your advanced accelerated Medicare payments. So we can help you. If this is something you're interested in, CareOptimize can help you. So we offer a free service. So if you feel comfortable filling out the application and submitting your own, we can provide you with instructions on how to do the service. But if it seems like a lot, because there really are a lot of steps in order to apply for your advanced accelerated Medicare payments, we can do the entire process for you, but you will be charged, or they will be billed on an hourly basis. Okay. Additional things that services that we offer during the COVID-19 pandemic are complimentary template, document, and report. So we offer a template that logs patients who test positive, but it also is for patients that maybe didn't test positive. It's for patients that have symptoms of COVID-19. So if a patient comes in, you can document where they tested for influenza, or did they have their pneumonia vaccine? Were they wearing PPE when they came in? What was their temperature? Who were they in contact with? Was the room sterilized? So it's really an incident report. It could be submitted to the CDC, state health agencies, and local health departments. We are also offering complimentary a report that will show all of your high-risk patients in your organization who should be considered for additional screening and other preventative measures. So you could run this report. It'll show you all your patients that are, over the age of 65 or have the chronic conditions that put them at high risk, and call them up on the phone, see how they're doing, making sure that they're following their hand hygiene and social distancing, and keeping as healthy as possible. Okay, we also are offering, or we have this as an offering, is our Analytico Quality Module. So the Analytico Quality Module is something that we use for clinical quality measures. So risk adjustments and quality programs drive your health plan revenue. Providers are focused on providing good medical care and consider coding quality programs a frustration distraction. So whenever you're, checking your flu shots, checking your pneumonia shots, colonoscopies, mammograms, those types of things, your clinical quality measures, we actually were able to transition our Analytico Quality Module into working with COVID-19. So on the next slide, I have a screenshot. We employed our services as a software of Analytico Quality Module to identify your high, medium, and low-risk COVID-19 patients so practices can focus their resources accordingly. So the primary use of this quality module is to easily uncover quality measures and readily suggest actionable solutions at point of care. But we were able to expand this utility, providing the module invaluable for this particular purpose. Patients were identified per CDC guidelines and tracked to see whether or not intervention has been completed via telephone call or visit. So typically our quality module would be used to identify patients that are, maybe they're non-compliant on their mammograms. But this is showing if they have not been contacted, if they are considered a high-risk patient. So for example, you will see here 96% of our patients that are at high risk for COVID-19 were contacted. There are only 13 patients, 299 out of the 312 were contacted. So there's only a handful of patients that have not been contacted who are considered high risk. So this is something else that we are offering to help keep up with your contacting your patients. There's also the medium risk and low risk, but of course the high risk ones are the ones that you would hopefully have as close to 100% as possible. Okay, and this also shows how our Analytico Quality Module works. So it takes data from HIE, claims, labs, hospitals, eligibility data, and it goes into the machine learning reconciliation within Analytico. So then from there, there is sort of a little flow that happens between the EHR that can go into the quality module back to the EHR. So they all work together with each other to give you up-to-date information on your patients to make sure that they're receiving the appropriate care and the highest quality care possible. Okay, so resources, we got our information today. So CareOptimize, CMS.gov, HHS.gov, SBA.gov, and another one for CMS on our telehealth services. If there is anything that you would like to have more information on, if you have any questions on any of the grants or loans that I went through today, please feel free to reach out to me at lauren.pacone@careoptimize.com or info@careoptimize.com. Also, if you would like any of our complimentary COVID-19 tools for NextGen or Analytico, if you are interested in learning more about Analytico, we do have demos that we are offering. As soon as you need it, we could provide that to you, so please don't hesitate to reach out if there's anything that we can help you with.